Hi there, everybody. My name is Steve Murray, and it's the topic of this presentation is really to help you navigate through your individual care plan that you'll find on our Healthie portal. So let's jump into that. You might notice that we do things a little differently around here. One of the things that's really important for us is that your health is a continuum and not simply an episode of care, and it's an active process. So the ability for us to create care plans that are individualized, personalized, and also flexible is a significant differentiator for us and really important in the way we do things. So your individual care plan will give you an overview, a map, if you want, of the pathway that your care team believes is the correct one for you to be pain-free and optimally healthy, which is really our goal for everyone. So the plan, if you're one of our physiotherapy patients, the plan will map out the amount of time that we believe it will take, the treatment elements. So, in other words, manual therapy versus exercise-based rehabilitation, or other elements, and also really importantly the potential costs. And it's really important if any of these, the time, the treatment elements, or the costs, are not possible for you, please let us know so we can look at other options. The reality is that with the strides that technology has made over the last few years means that we can still provide really quality care in a remote setting. So please let us know if we need to look at a difference or a change in your individual plan. Your plan will also include other elements that are critical in recovery. For example, nutrition, physical activity, and that includes your individual exercise-based rehabilitation program, the correct supplements for you to take, and other recommendations that your healthcare professional may feel is important to support you along the way. And you'll also have supporting documents, research articles, and elements like that that make it easy for you to follow. If you are on an orthopedic rehab program or chronic disease risk reduction program with us, your plan will also include very specific goals to help you stay on track. For example, the number of appointments that you need to make, whether it be with your functional medicine practitioner, your health coaching sessions, or follow-up assessments along the way, or to complete various forms and assessments throughout your program. What's really important is that this plan is a living document, and it will update and amend with you as you progress along your journey. So let's just have a quick look through an example so I can show you what it would look like. Okay, so when you open your individual portal, either on your phone or on the website, you will be able to see your care plan. If you have a look on top there, it's just to the right hand side of your dashboard, and you will see your care plan. If you open your care plan, you'll see a number of headings: activity, nutrition, supplements, other goals, and documents. So the first one is activity, and you'll see that there will be a very specific set of recommendations for you from your care team around physical activity. With nutrition, this is an orthopedic care plan, so you'll see that we give some recommendations in terms of how to eat effectively to heal, and we also even give you a recipe book, an anti-inflammatory recipe book that you can get in the document section. Supplementation is vital. Good supplementation, correct supplementation is vital for you during the early stages of recovery. So you will see recommendations here from the professional team around which supplements to take and what dosage, etc., that would be appropriate for you. If there's something in the other, that you would be able to see those. In this particular one, there isn't, but I've moved on to goals, and you'll see that I've been asked to make sure that I complete my exercise-based rehab, that I log my sessions, and that I book my coaching sessions. because in our orthopedic rehabilitation program, there are coaching sessions built into that to make sure that you can stay on track and stay safe and effective. So that's where you would find your goals. And finally, your care plan will include some documents. So in this case, there's a document on how to apply ice effectively, rest, ice, compress, and elevate. There's a really cool cookbook in here, which is inflammation busting foods, which is important to take care of during early recovery. You'll see we've got some information about why we believe the certain supplements are appropriate for you. And there's also a how-to guide for the actual movement app that we use. So I hope that makes sense for you, and helps you understand the purpose and the reason for your care plan. But as always, if it doesn't make sense, please reach out to us, and we'll jump on and help you figure out how to work it. Take care. We'll chat soon.